Hi, and welcome to today's edition of Canadian Colleague Connect. We have a really exciting topic that is beyond relevant is an understatement. Today we're going to be talking about long haulers and stress, inflammation, and genetics and how those play in to the symptomology that we see in long haulers. And for today's discussion, we have Dr. Penny Kendall-Reid, who we're thrilled to have with us. And before I get to that, I'm getting so excited to jump into today. I should cover a few housekeeping notes that we are here and you are listening to voice over IP, but you can also attach and listen via phone numbers using the phone number in the pin. But do be mindful that it is a long distance number, even though it looks local. Also, too, we want today to be really interactive. I know there's a lot of people articulate their excitement and lots of questions. So just put your questions in over the question panel, and we're going to have about 20 minutes towards the end of the hour that we're going to be fielding questions. But as they come up as you're listening, just pop them in the question panel, and we'll try to get to as many of them as possible. Okay. Now, without further ado, if I can introduce Dr. Penny Kendall-Reid. I know many of you have listened to her lecture before, and if you know about her history, for those of you not as familiar, she's the best-selling author of 5 books, including her newest book, which is Fix Your Genes to Fit Your Genes. And if you've listened to her lecture before, you know she is a leading force with respect to how genetics interplay with our health and physiology, and has actually created her own platform, GeneRx.ca, and helps to analyze and interpret genetic profiles for people all over the world. But I think beyond all of that, what is really amazing is, in addition to having such a handle on the genetics piece and physiology, Dr. Penny Kendall-Reid has a great appreciation for the psychosocial and emotional elements and how that interplays, which we're going to talk about today, and looking at the really big picture of how psychology and spiritual well-being also play into this. And if that all isn't enough, she also manages to be incredibly modest and humble. So that might be the greatest feat of all. So thank you, Dr. Penny, for being here with us today. We're really excited. Just last housekeeping is that everything that Dr. Penny and I discussed today is our own professional opinion and not that of the company. So without further ado, I'm just going to let you speak to this, because I think one of the most interesting things that we're seeing in the complexity for clinicians is that people struggling with long hauler syndrome have such very different presentations from individual to individual. So you want to just maybe speak to that?
Yeah, absolutely. We know that how aggressively an illness presents or progresses in a person and how quickly it resolves is very individual. And certainly our lifestyle, so diet and exercise and sleep and toxic exposure, has a huge impact on that, on how quickly we will, get better, etc. But what really is the great impact in the difference between two people who seemingly have similar health histories, they're presenting to us with similar symptoms, is our individual variability in our genetics, because that is what dictates why all of these symptoms are coming out from one specific type of illness. And when we talk about any sort of viral infection, and this is really so important right now, but it's also going to be important 10 years from now in a different viral infection. And it was important with chronic fatigue syndrome and mononucleosis. We just didn't have as much information at that point, right? Because some people would be exposed to chronic fatigue virus or monovirus. Some people would be fine. They found it incidentally in their blood work. And other people are flat out for months on end. Well, what creates all of that difference? And that's what we're really going to get into today, is what are those main symptoms that contribute to illnesses and creating all of these symptoms in long haulers. And it's really a triad of stress, inflammation, and all the side effects of those, and then our genes and how that impacts that. So let's start with what actually is a long hauler. Again, with any virus, it doesn't matter what the virus is. It's where symptoms persist for longer than 4 weeks after diagnosis, and usually it's actually months on end. And then what are those symptoms? Well, a lot of them are what we as healthcare practitioners see all the time in those mono patients, those chronic fatigue, the fibromyalgia patients. is fatigue, depression, anxiety, shortness of breath, dizziness, brain fog. All of those are not really that new that we would think about with respect to a viral load. And all of these get worse if the patient is more stressed or goes to exercise or anything along that line. But there's another set of symptoms that are really unique right now. And those are really, really variable. So I've seen everything from neuropathy, like MS-like symptoms, IBS-like symptoms, those alternating constipation, diarrhea, bloating, palpitations, migraines. There are such a bevy of all of these different kind of symptoms, but they actually all have one common theme. Whether it's that first page of symptoms, whether it's the second page. And we might think, well, why is one virus creating all of these different symptoms? Is there something that's different in each of us? It's not that different. There's one thing that's pretty unique in terms of its production, but this symptomatology can express itself anywhere.
And I think this is where we're going to ask the audience if they have any ideas, right, as to what exactly that is. So for those of you guys that are here with us today, thank you for being here, your time. And we're going to launch our first poll. And, looking at, just to Dr. Penny's point, why do you think that the long hauler symptoms are so varied, from the malaise to depression, neuropathy? Is it A, due to the higher number of people infected? Is it B, due to depressed immune systems? Is it C, due to inflammation? Or D, is it due to the virility of the virus that is kind of perfusing through society right now? And we'll give you a couple of seconds to think about that. And I'm going to close it in 3, 2, 1. Okay, so Dr. Penny, we've got
fantastic. Awesome.
Yeah.
They do all play a small little role for sure, but inflammation is the whole key behind long hauler symptoms. We know that 3 months after an infection, the actual viral load is not there anymore, right? But all the symptomatology is created because of that inflammatory response. And there's one inflammatory guy in particular, interleukin-6, which we're really going to get into, and it's prevalent everywhere in the body. It can be along that nerve root, creating that neuropathy. It can be in the endothelium of the blood vessels, creating that migraine. It can be in the gut, creating that IBS-like symptoms. And so that's why we see such a bevy of different side effects. And certain viruses really have a propensity towards stimulating interleukin-6. So what happens, it's not just inflammation, it's actually a triad of a couple of different issues. So we have, anytime we have a virus in our body, or when we have trauma, inflammation is stimulated. And there's a variety of different inflammatory markers, and we will get into those. That in of itself directly stimulates the HPA axis. So now we start to increase the production of cortisol. Cortisol then increases the production of inflammation again by 76%. So they start communicating and going back and forth and just increasing each other. We know that inflammation across certain inflammatory markers will, particularly interleukin-6 again and TNF-alpha, they will cross the blood-brain barrier, inhibit the production of melatonin in the pineal gland and the release of it, as well as the binding. So now we start to see difficulties transitioning into stage 4 delta wave sleep. And we know that that's the only time that we heal. Stage 1, 2, and 3, they're fluffy. It's all about delta wave. That's where our immune system goes, oh, there's this virus in me, I got to jump on top of it. Or I don't need to make this much cortisol or inflammation. All that healing takes place in stage 4. If we don't go into stage 4, that's another physical stressor, which stimulates the HPA axis again, which further increases the inflammation, which further inhibits the melatonin. Cortisol.
It's really this big cycle, right? You start to get one churn, and really, so when we're talking about inflammation, I think the key for all of our audience listening is that IL-6 piece. And so that part you're saying is a direct inhibitor of the deep transition from stage 3 to stage 4. So there's like a very direct correlation.
Yes, as is cortisol. Cortisol will also inhibit the production and the binding of melatonin. Cortisol and melatonin have an inverse relationship. So when melatonin should peak at 2 in the morning, cortisol should be its lowest. When we're hyperstimulated in the HPA axis, it does this. And that's why we're all like between 2 to 4 in the morning when we're in that stress mode. So if we leave one of these little variables untreated, it's just going to loop around and feed off of itself again. And if we see all of these variables right here, the virus is not actually in any of these variables. I'm not actually talking about treating that actual virus, because again, particularly with long haulers, the virus is well gone. It's all the side effects of that.
Less about the actual infection and more about kind of the carnage that trigger has set off.
Perfect word for it. It is the carnage. And so
and I'll flip to the next slide and you can speak to this. But my question to you is also that I think is really important for people who maybe don't feel stressed, right? Like they might not have that identification with high amounts of stress, correct?
So I'm a perfect example of that. I never sit there mentally and go, oh my God, I'm stressed. For me, it all presents in my GI tract. And this is where individual variability comes in again. For my husband, he increases endothelin in his blood vessels when he's, and he gets headaches when he's stressed. Knock on wood, I've never had a headache in my life.
Yeah.
But I produce neurotensin in my GI tract. I drop my production of digestive enzymes by 88% when I'm stressed, and my blows out right away. So when this starts to blow out, I'm like, oh, I must be stressed. And that's when I have to start thinking backwards. And I think a lot of people forget that stress has many faces. It is the nemesis of sleep. It has now been shown to be the #1 cause of all insomnia cases. But it's also IBS, and it's headaches, and it's weight gain, and it again, like interleukin-6, it's so proliferant in the body. It's everywhere. But we don't have to mentally feel that side effect. The other thing that's really important to know is what is just as stressful as being ill, having a loved one that's ill, not being able to pay your bills, not being able to work, is also the lack of joy that is in life right now with what's going on in the world. And as humans, we interact, we touch, we bond. And this is the first time ever in history when there's been a crisis and we've done this. And I think people are truly underestimating the impact that has, not just on serotonin and dopamine directly, but on the HPA axis. That lack of bonding is really a huge stressor. And so many times, and I'm sure so many of you out there sit down with your patients and they're like, I'm not really that stressed, but I'm waking between 2 to 4 in the morning, or their inflammatory load is high. And so we have to understand stress comes in many ways, and it presents with many faces.
I think that's just so poignant, big picture, that, the idea that we're not able to band together, right? And I'm sure our audience members can identify with it, how many times that, never mind being maybe outside of lockdown, but just reintegrating, and there's all this awkwardness of, do you shake someone's hand, do you hug them, do you fist pump, do you wave, do you air, there's a lot of, to your point, lack of joy. What the fallout from that is physiologically.
Absolutely. We'll get into dopamine a little later on as well, more specifically, but one of the things that increases the production of dopamine is getting out and doing things. And because we were actually not allowed to go out and do things, slowly dopamine was dropping and dropping and dropping. But then there's a catch-22 of it. When it gets too low, there's zero motivation to get out there and do things. So right now we can get out and do a little bit more. But now people's dopamine is so low that they're just like, oh, I'm just going to stay.
They don't feel like it's like, okay, Netflix and, and I remember because we spoke at the very, very onset of the pandemic in the Canadian Collie Connect, and that was your advice. It was like, get out, do things differently, make a different meal. If you go for a walk every day, take a different route. It was that novelty factor. And so many people have had the novelty of their life shrink down to.
Right down. Yeah. Absolutely. Absolutely. And then if you're somebody like myself who genetically makes very little dopamine, even harder, which we'll talk about. So if we take a slightly closer look at what's going on here in that sort of triad that I was talking about, and then the offshoots with it. So we have a virus which enters the body, and this virus particularly loves to stimulate interleukin-6, also interleukin-1 beta, but massively interleukin-6. Interleukin-6 directly stimulates the HPA axis, so now we start to produce more of that cortisol. Cortisol then, as mentioned, further increases the production of interleukin-6 again by 76%. Let's stop right here just with this axis. Let's say genetically you are somebody who produces a lot more interleukin-6 to the same amount of virus. That means you're variant for that gene. So just think about it for that person, when that virus comes in, they make almost double the amount of interleukin-6. So it's almost as if that viral load on their body was twice the amount of virus coming in to produce this effect. Now we're stimulating the HPA axis with a huge force. But what happens
if that's not being talked about, right? That's not being talked about. We talk a lot about viral load, and I think understand that the more viral load, but no one's talking about the fact that you might be a high IL-6 producer, so you could have this much virus and that much response.
And this is why we see so many people, they have an infection and they almost didn't know about it, or they were, tired for a few days. And then other people are so inflamed and have all of these symptoms. Then we have this greater load of interleukin-6, which is stimulating the HPA axis directly. It does it through a couple of different ways. It does it by killing off some of the microbiome, which we'll get into as well. Yeah. But it also literally stimulates the hypothalamus and the pituitary. And what happens if you're variant for those genes as well? So when those genes are stimulated, now you make twice as much stress hormone, right? So now we have twice as much stress hormone, increasing even more interleukin-6 that you already make a lot more of. Then we have all this inflammatory load, which also crosses the blood-brain barrier, and it blocks or inflames the neuroreceptors. It loves to inflame dopamine, melatonin, and serotonin receptors. All our feel-good guys. So now we're not sleeping again properly. Our dopamine starts to drop. Our serotonin starts to drop. So we start to now see some depression, some decreased motivation that's going on. Low dopamine and low serotonin are another physical stressor, which stimulates the HPA axis again, and that loops around. We also have that interleukin-6, which creates a lot of inflammation in the GI tract, as does cortisol directly. Then that's also going to start to play around with GABA, dopamine, and serotonin production in the GI tract, as well as the whole absorption of nutrients, our bowel movements, etc. All of these aspects, lack of sleep, inflammation, GI issues, etc., they're all physical stressors, but they also weaken all the tissues around it. If we're not sleeping again, we're not healing. If we're not healing and there still is a little bit of virus in us, it allows that virus to propagate again, and then we go all the way around the cycle.
Go back around.
And so we can't look at it, in these people who have all of these really exacerbated symptoms. And again, because interleukin-6 is everywhere in the body, if it's down the myelin sheath, if it's in the GI tract, if it's crossing the BBB, it still comes down to the same treatment protocol of we got to get that IL-6 down and everything else that's bumping up IL-6, which is the lack of sleep and which is the adrenal stimulation. Because if we don't treat one part of that little cycle and then get them sleeping, it's all going to inflame back up.
So basically, address the triggers that stimulate IL-6 and then help with the clearance.
Exactly. Yeah. And address all the variables that increase the IL-6, the HPA, the lack of sleep.
Yeah, everything that you've just kind of outlined that kind of churns that production piece.
And once again, nowhere in there did I say treat the virus.
Yeah, I know. I think that's really important, right? It's like, recognizing that IL-6 pathway and everything that, influences it, as opposed to just, deal with infection.
Absolutely. At the beginning of COVID, and we sort of mentioned this when we spoke at the very beginning, and we did the first webinar, when I was working with the World Health Organization, we're talking about why all the symptoms are so profound and why it loves to target, the brain and the lungs and all these different tissues. And again, the main reason is interleukin-6 is so prominent in that area. The reason why people who are diabetic have a much higher time is because diabetics already produce 2 to 3 times the normal amount of interleukin-6, even when their blood sugars are normal. And IL-6
Even
is
when it's normal. Wow. And I think that's really important because that's maybe not appreciated.
exactly. And IL-6 is stored in our fat cells, which is why people who have more weight are more susceptible to the bad symptoms, ending up in hospitalization with this.
Well, I think, thank you for that, because I think that is I think a lot of the stress can be around not understanding the physiology, but when you break it down and say like, okay, this is the pathway that's pushing,
Exactly.
it really helps. So
Exactly.
do you want to speak to this about where, when we're thinking about immune system, what is it? Where should we be diverting our attention?
Absolutely. And if Sam was to listen in on this now, who's going to be presenting, another version of or a different look at this
Yeah.
in his great upcoming webinar, I'm not going to do him justice here by any means, but we know that the basic immune response comes down to our T helper 1 to T helper 2 series. Our T helper 1 guys, they're the killing guys. They're the guys that say, okay, let's go out, let's jump on top of that virus. The T helper 2 side is the whole inflammatory side. And in a really strong and genetically balanced individual, when we're younger, this teeter-totter is very balanced, right? And if we get a virus, it tips up a little bit in terms of let's go kill, and then it teeters itself back down. What happens though, again, with long haulers is, one, they may not have jumped upon the virus quite as quickly, so they may not be able to recognize it quite as quickly, and there's a couple of genes that talk about that too, so that kind of swings the teeter-totter down this way. So the T helper 1 killing side kind of goes down a little bit, which means the virus has more chance to replicate. That's in the very initial stages. But the bigger thing is people who make more of those interleukins, particularly IL-6. IL-10 is another big guy here, IL-13 and interleukin-1 beta. The teeter-totter really swings to this level. And you can't, like a teeter-totter, you can't just do this, right? It's always going to do this. So when we really increase our T helper 2 series, that inflammatory side, we really downgrade our immunostimulant side or our killing side. And that again starts to allow things to proliferate. And it also allows for other opportunistic bacteria or virus to come in, because again, the immune system is weaker, the inflammatory load is higher. And so it might not be, the same virus that initiated the long haul symptoms, but you might, even if it's a yeast or a fungus, something that's just been hanging out in the body, now it's going to start to come out again.
It kind of opens the door. It makes sense. And, having listened to, Dr. Sam, I can appreciate how what you're saying about the IL-6, how that plays in, because just exactly what you're saying about that opposition of melatonin and cortisol, for our audience at home, if they're thinking about the seesaw, it is melatonin really helps to drive that Th1 response.
Absolutely.
So in cortisol, unfortunately, Th2. So if everyone's in balance, the seesaw is happy and everything's functioning. But to your point, if there's that overdrive, that's then inhibiting the lack of melatonin. It's not just the sleep and all of those pieces that get impeded. It's actually our direct effect and ability to fight off infection, be it the initial virus or anything else. To your point, then opening the door that keeps us locked in this house.
Exactly.
Yeah. So do you want to, I don't know if you want to speak now to what some of your kind of key approaches are to help, offset and balance, or if we want to keep going? You tell me.
Let's do that near the end where we sort of get into all the sort of variables that we treat, because there's more variables coming up. So
yeah, you keep laying the groundwork for us here.
So another area is actually that happens with these people is a little bit of what we were just talking about there. But so we have the stress response, which, as we saw or heard, increases the interleukin-6 production by up to 76%. And then that starts to, that just general inflammation all a long time, starts to degrade and irritate and break down the tissues, which then, when a tissue is damaged, our natural immune response is recruit inflammatory guys because it thinks that there's still an infection in there. So it recruits more inflammation to try to jump on top of it, to try to wall that off. And that further degrades away the tissue, further increases the inflammatory load. That degraded tissue without the ability to heal it is another physical stressor, which stimulates the HPA axis. And now we have another cycle, which is all going around again.
So again, that just another piece that creates that turn.
Yeah. This is a big piece for me. This is not just because I have an affinity towards neuro, but this isn't just specific to long haulers, or if we want to call this maybe the mental emotional long hauler, not just the physical long hauler. And what I'm already seeing with my patients, what I'm sure all of you are already seeing with your patients, is the mental emotional side effect of what's going on in the world right now. And a lot of it is because what happens is when we have a higher stimulation of our HPA axis, to focus, to concentrate, to stay on track, our dopamine binds, as we know, into the prefrontal cortex, specifically into the hippocampus, and that's our focus, concentration, memory guy. But when our HPA axis is stimulated, no matter why it's stimulated, our body thinks that we're hunting because we're very primal. We're hunter-gatherers. And the last thing that our body wants us to do when we're hunting for that saber-toothed tiger is focus in right here. Because what if over here or here or here is the tiger? So to help with that and to keep us very reactive while we're hunting, dopamine is forced out of the prefrontal cortex to the amygdala and the anterior striatum on the sides here. This is all our emotional area. So rather than getting that focus, we get that hyperarousal, that increased sensitivities. We get all of that emotional response without any of that focus and that concentration. And again, I'm seeing this with my patients over and over. They're just like, I'm finding it difficult to concentrate. Maybe it's because I'm on Zoom all day, but then I'll hear the same comment for someone who's been in the office the whole time, or from somebody who's not working. And it's not that we don't have the dopamine. Yes, we can look at our genetics and we can say you don't make a lot of dopamine or you do, but it's that pushing of whatever dopamine we have away from the prefrontal cortex. And so then that decreases our motivation. And if we have decreased motivation, we don't get up and do anything, as we spoke about. That also then starts to plummet our serotonin. And now we start to see this spiral down and down and down. And what do we do when we have low dopamine to boost it? We eat and we drink. What has everybody been doing during COVID? Eating and drinking. Yeah. It used to be the college, 20 pounds that you gain. Now it's the COVID 20. And it's sad, but that's what's been happening. And
if you are on Zoom, you don't have to even put real pants on, and so that's another you don't realize.
Exactly. And this is going to get more prominent and more prominent. I'm actually quite concerned about this for children, because I think a lot of kids are quickly going to be labeled as ADD when it's not really ADD. It's a situationally induced version of dopamine being moved elsewhere. And as natural practitioners in this case, it's really important to note throwing dopamine at this is the wrong thing to do, because you're just going to heighten the dopamine moving out. You're just going to give it more to go into the amygdala and the anterior striatum. You're going to heighten that emotional response. We have to move it back to the prefrontal cortex. And that begins with resetting the HPA axis, which is why it's being shifted over there.
I think this is a hugely fascinating clinical pearl. When listening to you talk about this, obviously very relevant right now, but just when we think about, post-traumatic stress, it is one of those conditions that clinicians have really struggled with. And I think that this is a huge missing piece where, we tend to think about things in excess deficiencies, but, really what you're painting the picture of here is the functionality, right? If the dopamine is just in a different place in the brain, it's more about shuttling it back into the prefrontal cortex. And to your point, that's by resetting that HPA axis, right? And I think that's key. When I listen to you, I love how you paint the picture of the hunting and gathering, because our symptoms, are intelligent, right? Our body when we're stressed, it's trying to put us into that protective mode of being aware. So that would get us not being stressed.
You know, it's we call it the squirrel syndrome, right? Like if I was truly hunting for that saber-toothed tiger, I want to be like squirrel, squirrel, squirrel. Where might that be? And that's literally what this comes down to. And I want an augmented emotional reaction, because I don't want to just be, oh, there's a squirrel there. Do I have to do anything? You want that emotional response to get you out. But you know, when we look at, when you were mentioning at the beginning of this, you know, people who now can go out and do some things, but they're hesitant. Not to shake somebody's hand, but I, as I'm sure we all see, I have a ton of patients who are just hesitant to go into a restaurant, go into anything. And a lot of that also still comes from this.
And I think even to your point, the social piece, right? Because, you know, there's maybe fear of germs and picking something up, but then there's also that kind of fear of rejection where you're like, what's the social decorum? None of us know anymore. Or, you know, is it, you know, you want to try to, we're social creatures and it's hard.
Exactly. And it's so much, which is really difficult.
Yeah. So,
sorry, I think it cut out there. It's dividing us greatly as a society.
Oh,
sorry. Can you hear me?
Yeah, I can hear you now. I think we had a bit. What I caught you say though is that it divides us. And back to your original point is we've never had a moment where we've been in crisis and not been able to come together, and we've done this instead.
Exactly. Just on a little stress note with that, the other gift that we've had during this time is chronic cutout from Zoom lectures, because everybody's on this now. So I do apologize if things cut out there. So another area that we see here that I've sort of touched upon is our microbiome. And we all know how important this is. But what happens here is both cortisol and interleukin-6, they actually inflame the coating that's around our microbiome, or our good bacteria. And there's little receptors on that coating, and they're called pattern recognition receptors. And that's what says to the immune system, oh, I'm a good guy, don't come over and kill me. And that's how we determine our good versus our commensal bacteria versus bad bacteria. But when interleukin-6 and cortisol both go and inflame those pattern recognition receptors, it doesn't look like self anymore. So our own body starts to attack those and break them down. And now our microbiome, particularly diversity, but as well as number, greatly drops. And that has a huge impact, which we'll see in the next slide, on our immune system and on our central nervous system.
And thank you for that, because I know we all kind of know that stress depletes the microbiome, but thank you for that's a very clear mechanism of action there. So.
And how we know the true impact with this, there's some great studies that were done. They took a group of mice and they genetically engineered one group so that they had absolutely no microbiome. And then the second group had their normal microbiome. And they put them into an elevated plus maze, which is one of those cross mazes. Two of the arms are covered and two of the arms are open. Mice hate open space. So when they blocked off the closed arms and forced the mice into the open arms, they started recording their behavioral patterns, and then they took their blood levels of cortisol afterwards. And what they noticed was the group of mice that didn't have the microbiome, they had very aggressive, very anxious behavior relative to the other mice, and the cortisol levels were almost 3 times the normal level. Then they did a microbial transfer from the mice that had the microbiome into the ones that genetically were engineered to have none, repeated it, and they all had identical symptoms. So we know that it's the microbiome which is impacting their behavior there that quick, and also their cortisol response. So a pretty powerful effect there.
That is, hugely tangible. So with all the aggression we're seeing in society, maybe everyone needs to take some microbiome nurturing supplements.
Exactly.
All right. Well, this leads us to our next poll question. So let me just launch this for everybody. So the poll question is: what is the most important variables when it comes to treating long haulers? And so you'll see there the options are the immune system and inflammation, stress, adrenal function, and sleep and inflammation, or stress, adrenal function, and inflammation. So we'll give you guys a couple of seconds to post your answers. And I'll close it in 3, 2, 1. Okay. So there we go. Yeah.
Yep, absolutely right. Although sleep is incredibly important, it's more of an offshoot of the stress, adrenal function, and inflammation. So it's key, but if we treat the stress, adrenal function, and inflammation, ultimately the sleep will regulate itself back out.
Take care of itself.
Exactly.
Thank you for that.
So when we note that, has anybody seen or had a patient, and now that they think back to that patient after we've had this discussion, of any symptom that they can't relate back to adrenal or inflammation? When we talk about long haulers.
Good question. So you guys can respond into the chat line there. Maybe will you just repeat that, Dr. Penny,
Absolutely.
for anybody who is,
Yeah, just wondering if anybody has, now if they think back to their patients with long haulers or any sort of long viral situation, what they can't actually relate it back then to an adrenal or an inflammatory state.
Well, it looks like I've got someone here just talking about blood sugar regulation and neuropathy, but they're saying just there's an answer here talking about the fact that the IL-6 that you mentioned earlier kind of clarifies that.
Exactly.
Imbalance, gait being off, someone just wrote.
So part of that can be inflammation down the myelin sheath. And then a lot of it is actually what I've seen is mast cell inflammation in the tympanic membrane. So almost like a little bit of vertigo, but coming from mast cell, because cortisol will directly stimulate mast cells. IL-6 not directly, indirectly, but not directly.
Interesting, thank you. And someone else is saying here, showing up for a day and then disappearing. So I think like speaking to skin rash actually, that they
like a rash coming up and
a rash that's coming up and disappearing. Welcome
to those mast cells again. So I'm a perfect example of that. About 15 years ago, not virally induced, but stress induced, I had head to toe rash, and I'm not allergic to anything. And the third derm that I saw handed me an article on stress and skin and said, learn how to de-stress your life. And that's when I started going down the whole HPA axis.
So that's a very great dermatologist, yeah.
Well, the third one. I had to go through 2 others first.
Two others to get there. Someone else, and I'm going to imagine this maybe relates back to, we've got a flood of flurry of things coming in now. So someone else said trigeminal neuralgia, and
same thing.
Relates
down
back to the myelin sheaths, and so just again where the mast cells are. Yeah. And so someone else is asking, similar with type 1 diabetes, same idea with type 2, or?
No, very different there. It's the type 2 that has the IL-6. The type 1 doesn't seem to have it. Now, if it's a type 1 that's less controlled or they're overweight, IL-6 is stored in the fat cells, but that type 1 diabetic might just be variant for that interleukin-6 gene. So they might just naturally make double the amount.
So unrelated to the type 1, but maybe just have that confounding factor.
Really good point. And I should have mentioned it was type 2. Yeah.
No, that's great. It's great having the questions. And I think the last thing, just maybe a little bit of heat wave triggered kind of shingles reactions. Heat wave or heat.
So cortisol doesn't like heat. So for and nor does IL-6. It literally inflames things more. But to initiate, did they have shingles prior? Like, is it a reactivation?
It sounds like a reactivation is what it sounds like based on, yeah.
Yeah, so when you have shingles, IL-6 will be up. So if it was more of a recent infection where it wasn't completely out, it could be that. But as we know, and this I don't have any, quote, proof on, so I'm just going by what I was thinking here. Trauma anywhere in the body the next time there's a stressor or an infection or something going on, it loves to zap over to that area, even if it's got nothing to do with it. So like I had a botched appendectomy several years ago, and for me, whenever something's up in the body, right there.
Right there.
So I think that might be one of the reasons, or it could just be the IL-6 and the reactivation of that.
Yeah, perfect. And I think, well, there's a couple more here, but there's just one more question. If they don't know it's pertinent, but what about flare-up of Raynaud's?
So Raynaud's is an inflammatory condition again. It's vasospasm, and we know that IL-6 loves to increase endothelin in the blood vessels and create that.
So kind of back to like what you're describing with the migraines, like you're saying, you know, that stress response, you know, has a migraine spasm, we could see that.
Exactly. There isn't usually, I can't think of one variable that creates a ton of different symptoms from a ton of different causes, right? So meaning, I've never seen one virus that through a different etiological route would produce a ton of different symptoms. And the reason, again, that this one is so profound is it loves interleukin-6 and it ups it in everybody, and IL-6 is everywhere. The difference in how we respond is literally, we'll coming to this slide right here. So
yeah, and
first gene, exactly, first gene IRF5. So this talks about how quickly does your immune system find a virus, see a virus when it comes into the body, and therefore start to mount a response. So if you're variant to that gene, that means that it doesn't see it very quickly. So the virus has time to replicate and create more damage before we sort of jump onto it. Interleukin-6, easy one, straightforward one. You're a variant for this, you make almost double the amount of interleukin-6 anytime something pops in your body.
And so now if you've got both of those and you get a high viral load and you're a high IL-6 producer, you've got really like kablamo. Yeah.
Yeah. TNF alpha, same thing. If you're variant, you make twice as much, close to twice as much TNF alpha. The reason I put this in here is because TNF alpha will always bump up IL-6 and IL-6 will bump up TNF. So if you're normal for interleukin-6, but you're variant for TNF alpha and you make a ton, you've got a lot more of another variable that's now propping up the interleukin-6 here. Then we get into some of the stress genes. So FKBP5. This is a gene which makes a protein which blocks all of the receptors on the hypothalamus and the pituitary. So it stops our glucocorticoids from binding into those receptors once the stressor is over and stopping further stimulation of the HPA axis. So it stops that, it inhibits that negative feedback loop. So if you can't stop stimulation of your HPA axis, you don't even need a stressor anymore. You're just pumping out those stress hormones.
Right, so it stops the interruption. Got it. Okay.
And so somebody who's variant for that gene makes a lot more of that protein. So they're blocking a lot more. So they're going to see a lot more symptoms, whether it's anxiety and depression or any of the other symptoms that cortisol increases. NR3C2, this talks about how many receptors do you actually have on the hypothalamus and the pituitary to bind those hormones. Some people genetically just have very few receptors. So even though they have the impetus to shut off the stimulation of the stress response, there's very few spots to actually turn it off.
Now, I am listening to you, and as somebody, you know, who has been intimidated and finds it overwhelming, having listened to you now several times, you see how important it is, and particularly in the context of what we're talking about today. So what words of advice do you have for those of us and the people in the audience who maybe are really understanding the importance of grasping this, and you know, how can they start to maybe toe dip, or, you know?
Genetics seems like a really scary subject, and I was scared at first when I first started looking into it, but it's really, if you sort of take a step back and learn a couple of the basic sort of layman's terms with it. So know that you can take a gene and turn a gene on or off. So on means it's making the protein that it's designed to make. Off means it's not making that protein. Each gene, when we talk about it, how I explain it to a patient is we take half a gene from mom, half a gene from dad, and that makes our gene. It's not really half a gene that we take, it's something called an allele. So we take one allele from mom and one allele from dad. Each allele carries with them, each different allele, different characteristics. So for IL-6, the normal allele carries with it, whenever a virus comes into my body, I make the normal amount of interleukin-6. The variant allele carries with it, I make almost twice the amount of it. So rather than getting caught up in the name of the alleles or all of this, just understand that normal means you make the normal amount for IL-6. Variant means you make twice the amount. And then, as healthcare practitioners, we know how to drop interleukin-6. We've got great tools, liposomal glutathione, NAC, boom. Your TNF-alpha and your IL-6 dropping right down. So it makes it a little less scary if you understand that each gene has an on and an off position. And what we're looking at is just look at that normal allele, look at the variant allele, don't get caught up in the letters with it. And then you just go back to, okay, so what would I do if I had a patient with high IL-6? This is what I would give them. And in the book, the reason why I chose to write this book, the whole first part of it is going through all the nomenclature of genetics and really easy to understand terms. So what is a SNP? What exactly does that mean? Because you hear it all the time, this SNP, that SNP, etc. What does that actually really mean? What is an allele? What does that all of that mean? And the sections that I chose to put in this book, rather than making an encyclopedia where we go through every section of genetics, is basics as healthcare practitioners. Our diet, our food, our metabolism, all of that. And then the stress response. And the reason why I put the stress response in here is you could treat any gene. So we could drop interleukin-6, we could use glutathione and NAC. But if you don't treat the stress genes, they're just going to re-stimulate this back up. Cortisol will turn over 90% of genes to their adverse position. They'll do the opposite of what we're trying to do. So you have to treat that section. And then what we eat is the foundation for what we do in terms of natural medicine.
And that makes so much sense. And can I ask you one, because I want to move on, because I really want to, we've got a really important part to cover about the big picture, but just from a clinical perspective, if someone is making more IL-6, if they code for the variant, they make more IL-6. As a clinician, is it about giving, in your opinion, more like a heavier dose of supplements to bring that down? Is it about you're going to just knowing expectations, you're going to have to give it for longer, it's going to take more time? How do you kind of manage that piece?
Absolutely. So some of the genes, we bypass the function of them. So it's so if that's the case, we have to give them that supplement for the rest of their life. So it's if they don't absorb vitamin D well, I've got to give them a higher dose of vitamin D for the rest of their life. I can't actually flip that gene. You have to bypass the function of it. With this sort of case in long haulers, I've been really blessed to be able to look at people's genetics as things started to take hold in this virus in the world, and knowing how this virus worked. Those people who are variant for interleukin-6 or these genes, I treated them right away, and I treated them with high dose. Yeah. Similarly, going into protection against this with vaccine, because the vaccine will also increase the production of interleukin-6, which is why we also see a lot of these symptoms with the vaccine. Just it's this much IL-6 versus the virus with this much. Right. So I will double the dose of liposomal glutathione and NAC 5 days pre and post vaccine, and people whip through it. When I saw people's genetics after they had got an infection, I see why they reacted the way they reacted. Like it was literally a night and day difference between how somebody responded, how they responded to a vaccine, their protection, and that was age independent. I had 90-year-olds who flew through the infection because they had had this in their body for a month prior.
Which helps, and it's like anything, ounce of prevention worth a pound of treatment, right?
Exactly.
Yeah.
Yeah.
No, it makes
so we've got those great tools. FKBP5, NR3C2, those genes, resetting that HPA axis. We've got Seronetin Plus right there. Seronetin Plus kicks that FKBP5 out of the receptor and heals it so glucocorticoids can go back up there. Similarly, COMT is our clearance of that. So we have so many tools as natural healthcare practitioners. We have so many amazing supplements. We have all of our HMF line of fantastic probiotics to help stimulate response. We've got so many amazing tools that we can use, but we have to, like anything, any ailment that presents in my office, you can't cookie cutter the treatment plan anymore, because this is one example how genetics plays a role here. The same thing applies with everything
And I think that, yeah, and I think that that's a perfect segue to, there's so many facets. And I know you're very passionate about this. And we've talked a lot about the physical and, emotional from the HPA piece, but I know there's a much bigger piece that you really like to shine the light on that is not getting enough.
Absolutely. So for me, and this sort of also goes into the next slide with this, so much of what's been going on in the isolation and has really made myself, and I hope for everybody else, stop and think what is really important in their life. We always say that thing that if you only had 1 year to live, what would you do with your life? And this sort of brought forward, well, why am I waiting till I would only have 1 year of my life to think about that? And that doesn't mean I'm going to quit my job and run off to, Bora Bora right now or do whatever some people might think.
Please don't.
Starting to put those things into place. And so I used to work so much prior to this, and to the point where if I was in a grocery store and I ran into somebody and they started chatting with me, literally what would go through the back of my head is, how long are you going to keep me here? I have to get back to do this. I have to get back to do that. And then all of a sudden it went to, oh my God, I can't chat with anybody because here I am locked down in my house. And now that's the only thing that's craving. And I went for so long without being able to see my family. My family all lives outside of the city. My husband is a surgeon, and the hospital had very strict rules on what I was also allowed to do. And all of a sudden my world got really small with what I used to almost get annoyed with.
Wow.
And I stopped myself and made that conscious effort. I downgraded my workload. I made that choice. I'm now going out of my way to make sure I see all of those people that are important to me or touch base with them. And if something comes into my head and starts nagging, saying, get back to work, I just take a pause. And so for that, I'm really grateful.
And so I think that's, and I love this quote that you put up here. Do you want to maybe speak to why you chose that particular quote?
Yeah, I think everybody has been looking at this or not everybody, a lot of people have been looking at this as, oh my God, this has been done to me, poor me. I am a victim here. This is this terrible, terrible thing that has happened. But we can choose to find some great in every experience. And if we can find some great, it is literally choosing to look at it. Is it a miracle or is it not a miracle as to how our air is cleaner because of what's been going on in the world? People are spending more time together. There are bad side effects, don't get me wrong, but we need to choose to really look at those ones. And, everybody says, I've had all my decisions taken away from me. I've been told I have to do this or I have to do that. We don't. We are not a victim here. You can choose to do this. You can choose to do that. There are consequences with both, but it is your choice. And when we realize that it's our choice, we take that power back and we realize that we are creating our future here. So it really is recognize that everything that's happening here, we have a choice in, and we have the ability to change what we want to do and how we want to do it in the future. And when we are so busy all the time, we often don't even have the space to think about that. But we were given some space here. And I really hope people take that time, think about it, and push that reset button.
I can't help but think, as you talked so much through the resetting the HPA axis, that, it really foundationally starts with resetting our perspectives.
Yeah.
as I listen to you. And I think that kind of leads us to our last slide here about, what is true healing? Um,
This one by Peter Levine for me. True human enlightenment will only happen when each and every single person on this planet will learn how to regulate their nervous system. And this is so true. If you've been at any of my other lectures where I talk about literally how we can pass cortisol on from one person to the next person just by standing beside them, and alter our physiology just by standing next to them. It right now on a global level, cortisol air levels have risen over 50%. Only each of us targeting our own self can then start to trickle, and we all have to do it simultaneously.
I have borrowed that on many times where I've said, if you don't think you're stressed, I've spoke about that study you talked about, that, the pheromones we give off, stress is contagious. And so the world is stressed. So even if you think you're really got it on lockdown, you can probably still use some heal. And
Exactly.
I'm going to blitz through these. I want everybody to know where they can get more of you, and that's next week. So they can register for that. And I'll quickly blitz through. And I think, as you mentioned, we've got Dr. Yannick up on deck for the final Canadian Colleague of the Year, where we're going to kind of continue the long hauler conversation. But we've got some questions here that I want to, as we come up on the hour. And so a lot of people saying thank you, hoping that there's a recording. That, yeah, there is a recording packed with clinical gems, so a lot of gratitude. There's one question here that's asking about, is there testing available to identify IL-6 levels, and if it's high or not?
Absolutely. So what I have my patients do is they're 23andMe. And with that, you can upload it into a lot of different programs. So you can upload it into Pure Genomics, that they've got IL-6. You can upload it into GeneRx. I've got it. But you can also, if you flip back to the slide with the genes on it, you don't have to flip back, but when you get your recording and you flip back on it, it'll have the, it's called an RS number, which is the sort of location for that gene. And in 23andMe, when your patient sends you their login information, you can go in and just put that RS number in browse, and it'll pull up the IL-6 gene, and it will tell you that coding. So if you just want to look at one gene, that's all you have to do. It's really easy.
Perfect, thank you. Someone else asking, when you reference double dose for the NAC or glutathione in pre and post vaccination, what's your dosing, and what's the double?
Absolutely. It literally is double what I've had them on before. So initially, if I'm retraining somebody's genes, I often have them on one liposomal glutathione and one NAC BID. So they're on just 2 a day. So I'll double dose them to 2 twice a day. And I keep them at that, when I'm retraining a gene is for 8 weeks, and then we can drop the dose down. So if they're in that initial 8 weeks, it's going to be 2 and 2 of glutathione and NAC. If it's after the 8 weeks, their dose of glutathione and NAC would be dropped down to 1 of each per day. So for that patient, I would just bump them up to 2 glutathione, 2 NAC once a day, 5 days pre and post. So
Perfect.
literally when I say double, it's double whatever their dose is when I get a hold of them.
Perfect, thank you very much.
If they weren't on anything prior, I would always go to 2 twice a day of both. Give them a high dropping down. You can't overdose on them, and you can't drop IL-6 low enough. Like it's only a positive thing. And increase your phase 2 detoxification. Yay.
Perfect, thank you. That's super helpful. Another question about, are there any anti-inflammatory agents that you're finding clinically working particularly well right now, or others maybe that are not particularly?
No. So our traditional sort of, curcumin, and that, again, that depends on your genetics, depends on one of your phase 1 genes called CYP1A2, whether curcumin is actually inflammatory or anti-inflammatory for you. We can throw in a bunch of other guys, but it's really all about IL-6 here when it comes to this virus. And our biggest, best guns are glutathione and NAC. And I've always been of the ilk of get very specific with the treatment, go high dose and kick it out, versus small doses of a bunch of different things. But curcumin particularly, you need to be careful with.
Perfect. Thank you. I'm maybe scared to hear your answer for this question, but how does coffee play in?
So
Yeah.
that's also a phase 1 detoxification gene. I fortuitously am very fast for that gene, so I need to slow it down. So I get 2 to 3 coffees a day to slow it down. That actually reduces my risk of a heart attack by 68%. So for me, it's actually really beneficial. So I code normally for that gene. If somebody's variant for that gene is very slow, caffeine would slow it down even more, and that would be an adverse effect.
So we do not want to do that. Now, is
No.
there any, for someone maybe who doesn't have the slow gene, is there any rationale or reasoning why you would still maybe want to take a pause just from stimulating or
So
not?
adrenal wise, again, if their adrenals are hyperactive, the caffeine can stimulate the adrenals. But very rarely have I seen caffeine stimulate the adrenals in somebody who requires the caffeine to slow down. Because what that gene does is it clears out the caffeine so quickly that they don't really get a huge effect from the caffeine. Those are those people, who, and I've never done this, it's just not me, but can drink coffee right before bed and still go to bed.
Yeah, the post-dinner espresso and then they're out. Yeah, totally.
Yeah.
One question, just is there concerns around 23andMe and data being sold? Is that, for anyone who's maybe, I'm sure you have a lot of patients that have maybe expressed that. How do you answer that piece?
So every genetic company will sell data. They sell data, and what they're doing it for, they're selling it for medical research. They're looking for this group of genes, if they code this way, they're seeing this disease down the road, that kind of thing. You are always a number when it's sold. You are never your name attached to it. But often what I'll tell patients to do is just use a fake name when they're registering on 23andMe. And there's no trade.
No issues. That's perfect. I think, I know we're already over the hour, but I really do want to kind of, again, I want to say so many thank yous up on the screen. Super enlightening presentation. I think there's a lot of gratitude. But while we wrap, kind of a final thought from you. What do you want people to most remember from today, and what would be your hope that they walk away and do differently?
So the biggest thing I want people to remember is that this isn't actually about the virus per se, or treating it. It's not about treating the virus. It's about treating the side effects of it. Those biggest guys being adrenal and inflammation. The takeaway is I really hope that you change your life in some way for the better. It can be small, it can be large, but it's taking away, changing something for the positive out of this so that we don't have a post-traumatic stress from this. We look back on this as, in the end, a positive experience. And I know that that sounds bizarre, but I want us all to look back on this as a positive changer.
Yeah, I think that's poignant. I think there was many gems given today, but I think that perspective shift is huge, deep rooted. So I would say thank you so much. The thank yous keep rolling in. So I think it was definitely hit, and lots of people grateful that there's a recording, because I think this was a very densely packed hour. So thank you so much, everybody, for attending today, and thank you so much, Dr. Penny, for your time as always. And don't forget, you can register and catch Dr. Penny next week. And I believe that metabolic, that probably there will be a lot of clinical pearls to kind of how to set that foundation.
Absolutely. All those blocks, people who are doing everything right and not seeing a response with their weight, will see all the sort of hidden areas where it is.
And a very different kind of webinar too for everybody who's on today, which will be a lot more kind of directly speaking to protocols and treatments and things like that. So
absolutely, tons of protocols.
It's kind of teased up well. Well, thank you very much, and have a great rest of the afternoon, everybody.
You too. Thanks everyone for coming out. Bye.